Well, the conversation today is about long COVID, what we know, what to do, and where to go. I have the pleasure of working at Sinai. I'm the division chief for general internal medicine and also the site director of one of our COVID centers of excellence. One of the things is just like how we responded to long COVID. And what we know is just like early in 2020, we were the first. And that gave us the opportunity back then to start learning about long COVID very early on. People recognized that there was something different and people were not recovering as fast as expected. So we announced back in May of 2020 our first post-COVID care center. Since then, we have opened many more. We are trying to really help the people from Harlem and the South Bronx, and we just opened another clinic. This is Dr. Engelberg on the right, and our clinic has from psychologists, navigators. We do testing there. We refer you if you need a specialist, and we do some social work. But let's talk a little more about long COVID. What is it, and what are the typical symptoms? The way that I like to define this is just a serious illness that can impact your daily life. I think that that's the way that I would invite everybody to view it, more than a fancy medical definition, because this is what we see. It can affect from head to toes. There's a lot of people that just have their lives changed because of long COVID. We have different names, and I think that it's just, if you were paying attention in the last couple of years, like from long haulers to long COVID to post-COVID-19 syndrome. And that reflects actually the fact that it's a new illness and people were trying to figure it out what name to use, what definition to use. What we know now is that if you had symptoms at least for 3 months, you are within that window that would make long COVID a potential diagnosis. But you have to remember that even within those 3 months, some of these symptoms can keep going, can come and go, and can get worse over time. So there's a lot of things that we cannot predict regarding the symptoms. But that's sort of the definition that we are now using. What are the symptoms? There's some that they're more common, but you have to remind yourself that there are like up to 250 different symptoms. It's just a huge amount. Up to 85% of the people, it's almost like 9 out of 10 people will say that I'm feeling tired. I'm feeling tired like never before. 6 out of 10 people will complain of brain fog. Memory problems, sometimes it's hard to find words. People have these pauses looking for words in their brains. Sometimes feeling just very tired after doing things, feeling worse after some physical activities. And that's also high up there. Almost 9 out of 10 people would have this. The other things, including shortness of breath. And sometimes we have patients complaining of their heart beating faster when they change body positions. So these are some of the most common ones, but anything goes with long COVID. And basically what I can tell you now, that medical providers like myself, we're used to just hear anything and everything. So don't think that this is just like the list. The list can be anything that is different from your pre-COVID infection times. Again, more than 200. And remember, it can last for years. By now, we know, unfortunately, there are some people that have these symptoms for almost 4 years. And the other thing, that it can present like not right away. Some people have periods of no symptoms, and then all of a sudden, 6 months, a year later, they start feeling different. So that is an important thing to remember. One of the things that we know, that some of the people affected by this became disabled. These are people that are unable to work like before, unable to help family members as before, just like people that were retired and just like have some pleasure doing some recreational stuff, going to the park, and now they can't. So very dramatic, and again, resulting in disability. One of the things that we know by now, and we didn't know at the beginning, there are some things that can make things worse. Your symptoms can get worse if you're stressed. Your symptoms can get worse if you exercise too much, or you have too much of like mental activity or physical activity of any kind. That we learn from the very beginning. And usually our approach when you are just feeling tired or just like short of breath, okay, why don't you try harder and build back that stamina, build back that energy? Well, it didn't work that well with long COVID. And we know that when we're talking about stress and exercise and some physical activity and mental activity, it needs to be carefully tailored to where you are with your long COVID symptoms. And of course, for stress, it's just any long COVID patient can tell you, but any chronic illness patient can tell you that stress doesn't help. The same for alcohol and caffeine and heat. Why do some people think that this is just a big health problem? I mean, the title of this article in the New England Journal of Medicine is just very interesting. Our next national health disaster. Is it a disaster? Is it not? Well, I think that it is. Why? Millions of cases. We're talking about millions and millions, and we're talking about 400 million cases in the world. Also, we know that these are very young individuals, but it's not exclusively of young individuals, but very young individuals. A lot of females. We don't have a test just to tell you, hey, yes, you have long COVID. We mentioned that there are different symptoms and many symptoms, and we have a poor track record in similar illnesses where we have a poor understanding of the illness. And one of the examples is chronic fatigue syndrome or fibromyalgia. So we have certain illnesses that we do not understand very well. And when these illnesses affect young people and sometimes females, traditionally the medical field has not been very in tune to the needs and sort of like turning away from things that were poorly understood in general. So we have this long list as the potential for the national health disaster that I was mentioning. This was in the news in September. And again, some people can still think, well, it doesn't exist, long COVID. What is long COVID? People are making this up. Well, I always say there's a lot of coordination for having 18 million people making things up at the same time. So what we know that this is affecting, this is the data from September, at 1.7% of all the people in America had symptoms, at least for 3 months. These are huge numbers. In this title, just to highlight, Hispanics adults were most likely to have long COVID than other groups. The information now still have the Hispanics very high on that list. And as we mentioned before, the problem is that some of these people are disabled. And that's the reason that we're talking about a health disaster. Young people that cannot go back to work, and some elderly people also that need to work and can go back. So we have greater likelihood of not being employed, and some people cannot really return full time. Our Sinai centers that we mentioned, we help navigating the difficulties of applying for disability if that is something that is needed. This is complex. We know that it's complex, but it's doable. So younger adults, more common in women, about 11 million people. We talk about Hispanics and our white population. There's some gender identity and sexual orientation that also is affected in a different proportion. We do not understand why. We have some theories, but we know that it's more common in transgender and more common in bisexual individuals. So something that we don't have an understanding, but we need to highlight as well. I have here on the right in this red little circle what we just said. But look at what I did not say before. It's not that our Black non-Hispanic population is not affected. We just said that when you read some of the things, it's just that we know Hispanics do have a big portion of the cases, the same our white individuals, but Blacks have been affected as well. Is this costing any money? Well, you bet. And we're talking about trillions of dollars because we see in a lot of cases. Part of the problem is like people are making less money and also they have a reduction in the quality of their life. The medical expenses, while there is not as big as these other two. But as you can picture, this is just a significant problem. What we talk about the disability, and the other part that I would like to add is like there are some recognition from the Office of Civil Rights, and we have at least 2 sessions of the American Disability Acts that contemplates help. If any of our long COVID patients do need a service animal, there's an application that can be done for that, or some special accommodations while standing in line. That can be done as well. Or additional time for taking tests. That can be done as well. This is just like to highlight to people how the U.S. government, Department of Justice and Human Services and Civil Rights are paying attention to long COVID because this is a national problem and a national potential disaster. Do we have any idea where's all this coming from? Well, I'm not going to go into details, but we know that certain viruses do not go away. They may hide somewhere in the body. We have the example of HIV virus. We're able to treat it, but unfortunately, we cannot get away. There's some reservoirs where the virus goes and hides. Perhaps it's what we have here, some particles of the virus, some little pieces of the virus. Some people talk about chronic inflammation, that your body, when it was sick, was so beaten up and so just inflamed in general with the virus that stick around and we still have it. There's one chemical in the body that's called serotonin, and it's the feel-good chemical. And that might play a certain role, and that's sort of like something that we're learning more. I think that the message here is just we're investigating, and there are a lot of people around the country and in the world trying to figure it out what's going on. And this may give us the opportunity to come with some treatments down the road. I would like to share with you what are the opinions of people that are doing some of the top-notch research. Talking about top-notch research, do we have a lot of information out there? Well, yes, you do. And you gotta be careful, and this is many months ago. You put long COVID treatments, you Google that, and in less than 1 second, you have exactly 2.360000 and more serial entries. I think that that's the value of having people dedicated their time, like our friends from Sinai, our friends from Smart University, trying to figure out how information is given to people and bringing the information that is a little more processed rather than just doing this. For example, can we do oxygen therapy? Well, not really proven and not too many in the city. And who would pay for this, for example? But if you Google it, it is out there. What I'm trying to say is just there's a lot of information. How useful it is, you have to really seek help because, again, suggestions for treatments, as I showed you before, endless. And the problem with that, it's like you can end up with 300 bottles of different things too. And unfortunately, this was a patient of mine. Couldn't make it to the end of the month, was spending all his monies on this. So that is the reason that we're talking about. It's not that we don't want people to come with ideas and try things, because again, for many of the people that are affected by this seriously, as trying things is something of importance, but you have to have a strategy. Otherwise, there are risks and definitely costs. And we are trying to think out of the box here. Acupuncture is one option, and the others like acupuncture, but the message again is like different things. Some people are talking about Paxlovid. Can I take Paxlovid for a lot of time? And many people do know about Paxlovid is the medication that you take when you're acutely ill with COVID, and there are some studies. The message here, it may be more than one medication eventually out there. Studies are fundamental. You cannot do this at home by yourself. It needs to have a structure that will protect you. Do we have studies? Do we have trials? Are they safe? This is just the question that we all have. What we know that the government has this like mega trial, which is an NIH recovered study that the National Institutes of Health. It's a very large study, 17,680 participants, include everybody, people that were hospitalized, people that were pregnant, children, adults, very nice distribution of who got included in this. And as you see in the graphic, also sort of like race and ethnicity was a serious consideration, since we know, as we showed before, that everybody's affected by this. So are they safe? Yes, they are, because it's a controlled environment. That doesn't mean that things can go wrong. And I think that I always make the differentiation between the two. And there is one, if you have problems with your sleep, there's one, if your energy levels is just not back to normal, there's just one, if your heart beats too fast when you move positions. There are several of them. Sinai is just one of the different sites, and we have the right way to refer you if you qualify for one of these trials. Important to have these trials in diseases like long COVID, where we know that they're not carrying any treatments. How to adjust to be chronically ill, because we said, okay, well, we don't have how to diagnose you, but we know that you have it. Can now give you treatment. So what can we do? Well, part is adjusting, and we know that adjusting has worked for other illnesses. What is it? Well, part of the adjusting is you got to seek realistic solutions, because we said before, it can be costly and really risky if you do not. One of the things that I've been asking people to do to adjust, keep a diary and tell me and tell yourself where you are with your energy levels, where you are with fatigue or your shortness of breath, and then think how we can adapt, what things you can change. And I think that this has worked in many diseases similar to this, and we talk about chronic fatigue syndrome. And I can tell you, this management of time and energy has been working very nicely for some of my patients. So that's something that I encourage. How much this costs? It's a piece of paper and a pencil. It's important to remember that, correct? We don't have to go fancy with our phones and another app. You can do it with a piece of paper. You will have your entire week in front of you. You document for a week what's going on, and you go back to that week and think how to tackle the moments that you felt miserable. This is not something that I invented. This is just like proven by the treatment of post-exertional malaise, the chronic fatigue that we call, and this is from the CDC. And what you have there is an ice cream, a timer. You time yourself. You learn how to distribute your energy when you have the energy, and you time for the next week. This was an all article from the New York Times magazine. What if you never get better from COVID-19? Well, I think that a couple of things to mention. A, some of the patients are getting better. So perhaps when the magazine put together this piece, it was just, we didn't know what we know today. And some of the people are getting better. Some of the symptoms of some of the people are getting better. And unfortunately, we do have some people that are not. But I think that as we continue to learn more about the disease, I'm happy to report that I have a couple of patients that came back and says like, hey, I'm back to normal. So just remember that even when you see articles like this one that was featured in the New York Times magazine. Is it hard being chronically ill? Well, it is. Being chronically ill is not simple. And this is an article that I put it there for you to see, not the title of where the article is coming from, but the date is from March of 2006. This is just all news. So when we talk about chronic illnesses, and we're talking about the old news, one of the things that we know that living without a clinical diagnosis, not having medical explanations, is not easy. It's just not easy just to wake up every morning or go into bed at night with symptoms that do not have an explanation. And they don't have perhaps this diagnosis like, okay, you have asthma. You know what it is. We know what to do. So not having that is just not easy. Part of it is just dealing with what will happen next. It's just one of the things that makes it different. And the other thing is just like many people may not believe you, exactly for the things that we mentioned before. And on top of everything, how does the typical long COVID patient looks? Well, it's not a typical look, and some people can look completely healthy, but it's not the looks. And the problem with us is just we, unfortunately, at times prejudge. You look great, so you're not ill. So our society doesn't make it easy for people to be sick if their illness isn't easy to see. And I think that we have had many patients, unfortunately, going through this, coming actually crying because even some docs did not believe that they were sick because they were looking great. So if you do look great in the mirror, but you have long COVID, you still have long COVID and you still have the challenges that we've been talking about. We came a long way. These are the three centers. The information is there. The three centers, the one that is closer to our friends in East Harlem and the South Bronx is the last center that we opened on 102 and the third floor. This is Madison and 102. It's a beautiful place. Again, social work services, referral services, some testing is done there. So it's just a beautiful opportunity for the patients that have not been able to find a long COVID provider, which by the way, is just difficult to find. So Sinai is a little ahead offering these services and the people that know what to do next. Here's the entrance and some information with a phone number and the email address. I just wanted to say a word about COVID and COVID vaccines. This is just little curves that I took from a government update about COVID-19. This is September. This is just not like 6 months ago, a year ago, 4 years ago. And what do we see? The curves goes up and down. When we have a little more tests that are positive and more people in the emergency room and a little more of hospitalizations, and unfortunately some people that are dead because of this, it reminds us that this is still going on. May not be in the front page of any paper today, but still going on. And we know what winters have done for COVID numbers. So pay attention to this and remind yourself that when we talk about long COVID, the only thing that we know is like vaccination reduces the risks of long COVID. 2 doses are more effective than 1. And that's sort of the end of it. This is the information. Nobody tries to convince nobody about any. That's not the plan. But you have to have the information so you can make the decision knowing the data. And the data has shown, and this is just like including studies, almost like more than 17 million people. If you got the vaccine, the chances of getting long COVID are reduced.
A lot of things in there, just the information, but also just affirming that these symptoms are real, that long long COVID is a real thing, that it's not always something that you can see, and therefore is not always something that is easy to communicate to other people or doctors even.
There are tests for many other things that can go on at the same time. Long COVID is a diagnosis of exclusion, meaning like you have to be sure that nothing else is going on. If you view it that way, what we invite our patients to do, hey, if you're coughing for like 2 months, just come and see us. And we'll figure it out and we'll put on the list of the different possibilities long COVID as well. So who got symptoms of COVID that were very bad and did not get tested because they were not tested? That's my hand there. So that was me. I got sick and very ill in March of 2020. Actually, I was out for a good 6 to 8 weeks. I couldn't get tested. There were no tests in your city unless you were in the hospital. So do I qualify if I have any symptoms? Did I have any symptoms? Well, I can share with you that I did have some symptoms that went beyond that 3 months. So at one point, I did have long COVID symptoms, and I qualify as a long COVID patient, as many people are there in the same situation. You don't have to come with the proof of the test. That's not how it works. And this is not something new, that many of our Hispanics and African Americans did not have access to the care while even they have COVID. And for long COVID, it's just the same. So spread the word. We do this in more than one language. Don't be shy. If you do not understand what's going on, and this is different from before you got COVID, just come to us. We'll figure it out if this is part of this new illness that needs better understanding and definitely better care